All right, so let's get started. I want to introduce my Brown University colleagues. We have Erica Larange. She is the Assistant Director of Student Health Insurance Operations. Christine Farland, who is the Assistant Director, Operations and Administration within Health Services, and Grace Cruz, who's the Assistant Director of Financial Aid. And then finally, Christy Sullivan, Associate Director of Health and Wellness. And Christy is going to give you a little bit of an overview of the Brown University team working with health insurance. And then we also have a special guest from our independent insurance broker. Christy, I'll kick it over to you now.
Great. Thank you so much, Mikkel. Good afternoon, everyone, and thank you so much for being with us today. I'm Christy Sullivan, the Associate Director of Health and Wellness. I'm also a registered nurse. I've been at Brown within Health and Wellness just for almost over 19 years now. Under my portfolio, amongst other responsibilities, I do oversee the Student Health Insurance Program. So the 5 departments within Health and Wellness at Brown embraces integrated, innovative approach to foster the health and well-being of every student. And these 5 departments are health services. And health services provides holistic care that is respectful of students' personal, culture, and social identities. Health professionals offer visits for urgent, routine care, 24/7 nursing advice, and we have an on-site lab, pharmacy, and x-ray services. We also have our counseling and psychological services, and they provide a range of mental health services, including individual counseling, referral services, crisis stabilization, after-hours care, and outreach programming and support groups. We have our Be Well Health Promotion, who through health campaigns, workshops, peer education, and individual appointments, Be Well provides health promotion services to support individual community well-being and healthy learning environment. We have our Student Brown Emergency Services. This was launched as a student club in 1978. The Student Staff Brown EMS offers 24/7 emergency care to the campus community. And finally, we have our Student Accessibility Services, and they facilitate accessibility services for students with physical, psychological, and learning disabilities. So regardless of whether a student has purchased insurance through Brown or has comparable insurance coverage, all actively enrolled students pay a health fee, also known as a health and wellness fee, that covers all services provided in these 5 departments, and which is in person, through telehealth, medical providers at, like I said, health services, therapists and psychiatrists at counseling and psychological services, and by the staff at Be Well Health Promotion. There are also benefits such as 24-hour-a-day, 7-day-a-week nursing advice, on-call physicians, and CAPS after-hours services. So now that you know a little bit more about health and wellness, well, we're on to for what we're here for today, student health insurance. I'm very excited to announce that starting with the 23-24 academic year, Brown has the pleasure to now be working with a student health insurance broker, Haler, Fryer & Kuhn. Haler services over 200 colleges and universities for their customized needs. They work as an advisor and intermediary between Brown and our insurance carrier, United Healthcare Student Resources. Their services include the enrollment and waiver process, policy questions, claims assistance, ID cards, locating providers, anything in that realm. And now I'd like to turn our presentation over to Ashley Wilson from Haler. Ashley is Brown's collegiate account manager, and we are so thrilled to now be working with Ashley and the Haler team.
Hey everyone. So we're just waiting for my PowerPoint to come up. There we go. So it is lovely to meet everybody today. So my name is Ashley Wilson. I service the student health insurance for Brown University. So that's anywhere from day-to-day needs. So you have a claim issue, you need a copy of your insurance card, you need help submitting a waiver, enrollment. That's where we come in. You can answer any of those items through our office. We're able to assist you with that. So we'll go to the next slide here. Okay, so the big question we always get is who is a mandatory student? So all full-time and part-time undergraduates and graduate level students, and then even also guest students from other institutes are required to participate in the university student health insurance program, unless you submit an annual waiver and it is approved. Go to the next slide. All of this action can be taken as of June 15th. Once the portals open on June 15th, all Brown students will receive an email to their Brown University email address. This is going to give you a reminder that action needs to be taken at that time, and you actually will get weekly email reminders indicating that you have to take action up until the deadline of 9/1. And this does have to be completed every year. Next slide. Okay, so a little bit about the health insurance plan. What does the plan feature? So it's an ACA compliant plan. And what does that mean? So that means you get coverage for preventative care, primary care, urgent and emergency care visits, hospital care, mental health. You can get your required immunizations, prescription drugs. If you have to ride in an ambulance to the hospital, it will cover you that, any maternity care, and then also evacuation and repatriation to your home country, or if you're traveling abroad to get you back safely. And then there is a teledoc service as well too. So if you don't have time to go to the doctors or the medical center at the university, you actually can call a doctor through United Healthcare, and they can actually do a Zoom meeting with you to do any of your treatments from mental health or even just like a sickness. They'll be able to assist you with that. The coverage runs from 8/15 until 8/14, and then this is the anticipated annual premium of $4,636 for the health insurance plan. Next slide. And then this is a little bit more of a deeper dive of the health plan, and a lot of questions we get about insurance is what's a deductible? So the deductible is the amount you pay annually before the insurance kicks in. So this plan has a $300 in-network deductible. Co-insurance. The co-insurance is the cost that you're required to pay for each provider visit. So a lot of the treatments have a specific co-insurance. So this is where you're going to kind of get into the details of like, if you go to an office visit, it's 100% co-insurance allowed. Copay, a fixed amount that you pay the provider before the insurance kicks in. So some of the co-payments are, for example, a physician's visit. You have a $30 co-payment, and then it's 100% allowed to you, not subject to the deductible. And then finally, in-network. So this is where you're going to go to an in-network doctor where you get a deeper discount as opposed to going out of a network doctor. In-network is where you're going to save money out of pocket for those doctors. And we actually will have a link for you where you can find an in-network doctor either while you're home, while you're at campus. This will help you save money at the end. Next slide. There is a voluntary and dental vision option for you as a student. It is billed annually. The monthly premium is at the bottom of the screen. This is where you can go and purchase a separate dental coverage and then also a separate vision coverage as well to meet your needs. And there's a little bit of quick summary here. Okay, next slide. And then waiver eligibility. So if you have insurance either through yourself, mom or dad, through the state, you can actually submit a waiver and it is going to be reviewed. The insurance does have to be from a US-based insurance company and it has to be ACA compliant. It's essential health benefit plan. Your coverage does have to cover you for the entire school year. So it can't just cover you for a couple months when you're first at campus. You have to make sure you have coverage for the entire year while you're at Brown University. And then you do have to have coverage for not only emergency treatment, but also non-emergency treatment for mental health and medical within 50 miles from Brown University. So these are some of the waiver requirements that we're actually going to check when you submit your waiver through our waiver portal, which opens on June 15th. Next slide. Okay, the biggest question, where do I take action? So once the portal's open, you're actually going to visit our website at haler.com. And when you get those welcome emails, you'll actually get the link right in that email that you can click and it'll send you directly to the website, which is really nice. You can share this email with mom or dad, or the student can take care of it themselves. So within that email, you're going to click on the link on June 15th or after, and that will send you directly to the site. Next screen. And then this is what it's going to look like. So this is the specific waiver portal for you guys. What you're going to do is enter your last name and your student ID. So your student ID is going to be exactly how you enter on any other system through Brown University. So if there's any leading zeros, you want to make sure you include that. Any sort of numerical number, make sure you're not missing any, otherwise it won't let you in the system because it is a private system where we're not going to let anyone just go into that system. We do need to make sure that we have the correct student submission. Next screen. You are going to select that you agree to the release form, and that's basically just summarizing that you're entering based on the true knowledge of what you're putting in for yourself or as your student. Next screen. taking action. So this is where you're going to select if you want to enroll or waive. So enrolling means you don't have insurance. You're accepting the school's insurance because you don't have specific insurance that either doesn't meet the university or you don't have any plan at all to cover yourself. And then a waiver, you do have insurance either through mom or dad or yourself. You would like to submit a waiver so that you're not going to be charged for the insurance to get that removed. Next screen. So for enrollment, the basic information we're going to need is the student's first and last name, their date of birth, their gender, mailing address, and email address. Simple information just to make sure we have the right data to be able to send to the carrier to get this processed for you. Once you submit that, you'll actually get a confirmation email to your Brown University email address, and that will give you instructions that we've received it. We're going to send it to the carrier, and then you're also going to get an email from United Healthcare telling you that you've been enrolled and here's how you get a copy of your card. So you should be getting two emails, a confirmation from us that we received it and we're processing it, and then a confirmation from United Healthcare telling you that they've done this and you're going to get your card. Next screen. And then waiver. So if you're going to submit a waiver for the health insurance so that you're not going to be charged, what you'll need is make sure you have your active insurance card handy and ready to go. So this is the insurance information that you're going to put in the system that shows I have insurance through mom or dad or myself. You're going to enter your first and last name, your date of birth, your gender, your mailing address, your email address, and it does have another section where you can put a private email address. You could put mom or dad's in there if they want to follow this as well. And then the policyholder's date of birth, and then all your information from your insurance card. So who your insurance is through, your member or subscriber ID number, a group number if you have it, and the insurance carrier's phone number is all the information we're going to ask from your insurance card. Once that's submitted, you're going to receive a confirmation email to your Brown University email address, and then also to that private email address that you entered. So it could be either mom or dad or your other email, your Gmail or Yahoo or wherever your other email address is through. And that's going to tell you that it's being reviewed. So once we receive your waiver, we're going to review it and make sure that it does meet the requirements for the university. Then once we reviewed it, you'll actually receive a secondary email to let you know if this was approved or declined. If the waiver is declined, you'll get instructions on exactly what we need to re-review your insurance information. And sometimes that's just because, oops, I accidentally included the wrong insurance information. That's my insurance from last year and that's not active. So we always just like to make sure that you're including the correct information. So we might reach out to you and ask for another copy of your ID card. Once it's completed, we'll let Brown University know who had a successful waiver, and they'll actually take that charge off your bill. Next slide. And then this is just like a little screenshot so where you can see a little bit at the end of the portal. You're going to put your insurance card in there so that we can see a copy of it. And then you're going to sign it, or mom or dad's going to sign it on the screen, just letting us know who submitted that waiver. Next screen. And then this is what it looks like once you've submitted it. It's going to tell you that we've received you as a waiver and it is being verified, and that you've selected to submit this as a student, and you'll get that confirmation email. So this is just a little snippet of the portal. And then next screen. And then here's some contact information. This might be something that you want to take a quick screenshot of or a picture of. This is where you're going to get all the data of our office, where you can contact for any waiver submissions, enrollments, insurance questions. You can contact us through the number or email address. And then at the bottom, it actually has information for United Healthcare. So if you need assistance with the telemedicine, if you want to assist with having a claim submission, if you can't get through your UHC portal, there's some contact information there as well. So that's something I would always recommend either mom or dad or student take a quick picture of it just so you have that in your phone. And then next screen. And that's it for me. Thank you guys for letting me be able to present to you on the health insurance plan through Brown University.
Great. Thank you, Ashley. That was really helpful. I want to go over a few key points that you had in that presentation. One is all of this information is going to go straight to the students, right? So we have a lot of parents on this webinar, and so I guess what was that date again that the portal opens?
June 15th.
So June 15th is a big date to mark down, and I would say to parents, it's a good time to check in with your student, maybe sit down and have that conversation about health insurance. And would you suggest that the parents go through this together with their student?
It's totally up to the student if they want to do it together with their parents or if they want to do it their own, it's up to them. But they will receive that weekly email to their Brown University address that they can share with their parents if they want help with submitting it.
Great. And I think that's a good note for parents overall, is just all this communication. The primary recipient is going to be the student. So if you're wondering if your student got an email about health insurance, they probably did. I would check with them first. Now we've got a few questions come in, and I'm gonna go through the folks here on the webinar. But feel free, everybody, to chime in, whoever has information to share. One, again, and I think you went through this in your presentation, was about folks who have insurance coverage already, either through an employer or somewhere else. What are the pros and cons of staying with their own health insurance versus accepting the Brown University health insurance plan?
Yeah, so we just want to make sure that the students have active coverage that meets the university's requirements and then also covers them while they're on campus. So they want to make sure that they call their provider when they're looking at insurance options on staying with their parents or doing Brown University. Always check with your provider. Make sure that you are able to see doctors within the area of 50 miles from campus, because the last thing you want to do is show up to campus, waive the insurance, have your own health insurance, and then an emergency happens and you find out you don't have coverage. That's the worst thing to come up. So you just want to make sure that you're fully protected while you're at Brown University. And if you do truly believe your insurance plan meets those needs, you can absolutely submit a waiver.
Great, thank you. And then you'd mentioned that you have to provide proof that the student will be covered for the entire academic year. What kind of proof do you need to provide? What form does that take?
Yep, so once they submit their waiver, we're actually able to check that when we're verifying it. So you actually just have to provide your insurance card and we do all that information on the back end. Now, we are aware that some employers do update their renewal and they sometimes get new cards with transitioning for the new year. That's okay, that's usual. We do get that come up quite often. So if you do get an updated insurance card, you just want to make sure that you send that over so we have it on file.
Great. Another question that came out is if they waive the medical insurance, can they still get the vision or the dental? Okay, great. I think this next one I'm going to pose to Grace. This is about students who are on financial aid for tuition. Does the financial aid package cover copays and out-of-pocket expenses?
No, unfortunately, it does not. It does not cover co-pays or out-of-pocket expenses.
Okay. And if people have more questions about financial aid in relation to health insurance, should they start with your office or should they start with health and health services?
I think either one is fine. If they send information, if they send a question to us and we need assistance from health services, we'll reach out to them and vice versa. I think we work closely enough that we can figure it out.
Absolutely. At this time of year, I think you guys are having a lot of conversations, right?
Right.
Let's see, some other questions that have come in. These are great. How do you handle students who only need health insurance for the spring semester? I'm not sure if that would be Ashley or Christy. Is that something that's a possibility?
So if the student has active insurance and say they're having a qualifying life event, so they're aging off mom or dad's plan, they can contact our office. We'll need a termination letter from their current insurance carrier and we'll able to start the insurance based upon the day they're losing coverage. So if they're under mom and dad for the fall semester, their insurance is renewing, they're not able to renew on that insurance plan, we can enroll them for the spring if that's the date that they need, or we can enroll it based upon the qualifying life event.
Great, thank you.
Mhm.
If a child needs something like a monthly allergy shot or vaccinations, is that covered under this plan?
Yes.
Great.
Yep, they would just want to present their health insurance card just like they do at any other doctor's office and it'll go through the insurance process.
Okay. And as far as out-of-state coverage, is the 50-mile radius a stringent requirement?
Yes, we do want to make sure that they have coverage within 50 miles from campus.
And is telehealth ever considered in that equation when you're looking at waivers?
Not usually, no. So what we want to do is we want to run based upon the providers within the area of Brown University is when we're checking that radius.
Okay, thank you. I'm gonna, I have one for Christy. This is a more general question, I think, for health services.
Sure.
We got a lot of questions submitted in the registration about mental health. Can you talk about what mental health services at Brown are covered by the insurance plan? I know at the beginning of the webinar, you reviewed a pretty decent list, but if you can talk more about what's covered and also how students go about receiving care.
Sure, absolutely. So the care that's provided at Health and Wellness, which includes counseling and psychological services, it actually is not billed to insurance. So all of those visits are covered under the health fee that's paid as part of the tuition. That's a mandatory fee for all students. So we do have licensed therapists, we have psychiatrists on staff, and those are all covered under that fee. And a student would just contact counseling and psychological services to set up an intake visit, to see a counselor. If it was thought that the student needed more extensive, something that needed frequent visits that, we might not be able to provide here, then we can look at therapists in the area that are covered under the United Healthcare insurance and refer out to the community. We do have a list on United Healthcare site, what Ashley was talking about with Find a Provider. There's actually a link for Find Behavioral Specialists that can be clicked on, and you can find a behavioral specialist that accepts the insurance within this area or within your home area as well.
Great. And somebody wanted to know, do you happen to know, Christy, what the health fee is for the upcoming year?
I
Or where
believe-
we can find that.
Yeah, it is on the health services website currently. It was just updated, and it's $545 a semester.
Great, thank you. We had a couple of folks, I think they wanted us to review again. If a family gets a waiver, a student gets a waiver for their health insurance, can they still access the services at Brown University?
Absolutely. They are actually two completely separate entities. So you do not have to have the student health insurance in order to access health and wellness care. That is all covered under the fee that every student pays, the health fee.
Great, thank you. Let's see, lots of questions rolling in. So this I think is related to what you just were talking about. Do providers at Brown Health Services accept outside insurance? So
we don't bill outside insurance.
Okay.
So that's saying, so all of the care provided at Health and Wellness is part of that fee. We do not bill outside insurance for any services.
Okay. And can you talk about how health insurance works when a student is studying abroad?
I think I'll pass that on to Ashley. I think she'll be able to give the best answer.
Yeah, absolutely. So if the student is enrolled in United Healthcare's health insurance plan, it does cover them while they're studying abroad. If there is an issue that comes up, that's where I gave that last screen that had the phone number on. And then also there's an email address that they can call if there's an issue that say they need to be evacuated, there's a political issue going on and the student doesn't feel safe anymore. They can actually call that United Healthcare number. They're going to set up a team to basically come in and rescue the student and get them out of that unsafe situation. If something happens where the student passes away and they need their remains sent back home country, or they're abroad and something happens and their remains need to be sent home, United Healthcare is also going to help coordinate that too. So there is coverage for the student either on campus, off campus, studying abroad. They're covered through the United Healthcare plan.
Great, thank you.
Mm-hmm.
Another one for Grace regarding financial aid and health insurance. This one is about, so we already covered that it doesn't cover our co-pays, but does it cover the premium itself?
So the 4,600 that charge?
Yeah, the question was the full medical, vision, and dental premium.
So the way that we don't cover the vision and dental. A student, because a student is required to have health insurance on campus, if they go through the waiver process and they don't have adequate health insurance, for example, they have Medicare or something that is not adequate to the health insurance we're offering on campus. If you are an aid applicant, we do have scholarship to help cover the $4,636. But it's only covered if you go through the waiver process and you don't have adequate health insurance, or you can prove that you don't have any health insurance. We will not cover it if you're choosing to take it on as a second insurance, or because you feel that our health insurance or the health insurance offered is better than yours, but you can still go through the waiver process, if that makes sense.
Okay, so if there's questions on this, it sounds like to go ahead and go through the waiver process and see where that leads.
Yes, so go ahead, submit your insurance card, insurance information, the whole process. And if you're kicked back, if it's denied, if it says this is, it's not adequate health insurance, I work closely with Christy and Christine in health services, and we will figure out if the student is eligible for the scholarship.
Got it. Thank you. So a question came through, if you have out-of-state coverage, what are the benefits? And this might be for Christy, I think, or Ashley. What are the benefits of getting the Brown health insurance plan if your family already has a plan that will cover the student?
So I'm happy to take this, and Ashley, please feel free to jump in as well. So, I mean, with having the student health insurance plan through United, we have done a lot of work with, as you know, as I mentioned, there's a laboratory in our building for student access. With taking the student health insurance plan, every lab test that gets submitted through that lab is going to be covered 100%. With outside insurance, you need to worry about, is this lab in network? If this lab is not in network, what labs in the Providence area does my insurance take? Your student might need to go off campus to get laboratory tests done. So that's one thing to consider. And we also, our staff here, and we have a few staff members who will work with students if they need to see specialists in the area, such as orthopedists, cardiologists, gastroenterologists. If we need to refer off campus, we definitely have a knowledge of what providers we can send these students to, and the visit is going to be covered. Where it can get a lot more challenging with outside insurance to find somebody in the area, and it might be out of network for you. You might end up with a larger bill. So, I mean, there are definitely benefits to having this, and we know that it is a platinum plan. And we work very hard to make sure that we are giving our students the most coverage that we possibly can, because the last thing we want to see is our students end up with a large bill for something that's unexpected. You're never going to think something's going to happen, but it will. And so we want to make sure we are giving our students the best coverage possible.
Great.
Yeah, and you do have time to submit the waiver too. So give yourself a little bit. Don't just immediately submit the waiver. Look through the policy, compare it to your current plan, see what plan meets your needs. If you have something going on, like I have to go to the therapist every week, isn't this cost effective based upon my plan or the Brown University's plan? So I always highly recommend do a comparison to what you're currently enrolled in, how much you're paying through your employer for your student to be enrolled in that insurance, and is it cost effective to enroll in Brown University's plan compared to that.
Great. Thank you, Ashley. And if this is a complicated topic, obviously, if people have questions, we'll chat out the link to both Ashley's office and Health and Wellness, where you can go for more personalized information. And students, I guess this might be a Christy question. Can students walk in and speak to somebody about their health insurance plan if they're already on campus?
Sure. To the health insurance plan, what I would ask them to do is actually email the student health insurance plan email and set up a time. They'll actually be meeting with Erica, the Assistant Director of Student Health Insurance Operations. She will set up with students to meet with them in person. She'll meet with them by Zoom. Whatever is best to fit the student's needs. I just say don't pop in because she could be in another meeting with another student across campus. She might not be in the office that day. So I just to be respectful of the student's time, I just want them to set it up, and we definitely we're happy to do that.
Okay. And we just talked about therapist and wellness. That is covered in the health fee. That's correct, right?
Correct.
But if somebody had a specialist that they needed, then that would be outside the university. That's when you would be looking within your network for a different provider outside of
That is absolutely correct. Yes.
Okay. And someone's asking if they have United Healthcare already, is that the same as is it necessarily the same as what Brown is going to offer?
It could be completely different. I wouldn't be able to answer that without seeing a copy of their policy. Every plan is unique and individual, depending on through your employer. This is a student health insurance plan, so it's United Healthcare Student Resources. So it's not directly just specifically United Healthcare. It is specifically created for students.
Okay. If, say, a student does take the Brown University Health Insurance Plan and they're home for winter break or over, a different holiday, if they're at home, will the Brown insurance cover a doctor, say they're in California or Texas or wherever else?
Yes, yes, it's worldwide coverage, so it will cover them while they're home, either on Christmas break, spring break. They will cover them wherever the student goes. They just have to present their insurance card at any doctor's appointment or pharmacy that they visit for medical treatment.
Okay.
And as Ashley shared earlier, if you're looking for a provider in the area of where you are, maybe you're home, maybe you're on vacation somewhere for the holiday, you can use that find a provider link and you'll be able to find somebody that is in network in order to be seen.
Great. Thank you. And on the opposite side, for families that are looking at their own out of network plan, how do they check to see if local medical facilities and labs in the Providence area might take their insurance?
So they should be able to either call if it's through their employer, call their employer, and they should be able to give them a directory provider. If they are not able to get that through their employer, they can actually call the number on their health insurance card and give them the Brown University zip code and say, hey, my student's going to campus here. Can you just tell me if there's doctors in network that we can go to and have them give you a list? They can even send it to you via email.
Great, thank you. And Ashley, is there a high deductible option?
This is the only plan that's available to the students.
Okay, so it's one plan, so one decision, right?
Yes.
Okay, and this is more touching on financial aid, but will the family contribution change based on whether a family decides to enroll or to waive health insurance for their student?
No, the family contribution doesn't change. The health insurance, the 4636 fee is it's not included in the budget. It's not included in the cost of attendance. So it wouldn't change your contribution. If you're taking the health insurance, if you choose to take this health insurance, that is an additional charge you're taking on, but it's not affecting your contribution that we have determined for the year.
All right, thank you. Ashley, where can people viewing this webinar find detailed information about what SHIP covers? I'll share the link to the SHIP page on the Brown website, but is there a specific place that they should go to see those details?
So we should have that information available in June on the website. The carrier is still developing the brochure for the 23-24 plan. So once that is available, we're going to have that on the website for the students to access, but that will be available for the portal to be open in June.
Great. Yeah. Christy, do you want to talk a little bit about that changeover process? Because we are going from one system to another.
Yes, absolutely. So, for the parents on here today, if you go to our website and you start clicking on the links, please don't get nervous if you don't see Haler's information on there yet. Currently at this time, we're still in the 22-23 year and we were working with the broker Gallagher. So for current students who are at Brown, they're still utilizing Gallagher as our broker. But we expect by the end of next month, beginning of June, that everything will change over and with plenty of time before the waiver opens on 6/15.
Great, thank you. And Christy, are there any sessions like these that you're aware of that are specifically for the student audience? I know Erica, our insurance officer, is fairly new, and we're so glad to have her with us.
Yes.
So if you could talk a little bit about what kind of information they directly receive, that would be helpful.
Sure, absolutely. So most of the information that the students receive, newer students receive, would be through orientations that we are present for, but we are always looking to increase our visibility. And I would love to be able to do these sessions for students as well. Unfortunately, a lot of times this isn't a high interest for students, and it's typically more of an interest to parents than students, but we are always available for students to contact us, by email, and they do often, which is great, to answer their specific questions. Because a lot of times they may not want to approach us at an orientation with a specific concern about what is covered under their health insurance. But we always try to make ourselves completely available to these students whenever they need.
Great, thank you. This is another one I think that might go to Grace. If a student is pretty sure that their insurance isn't going to meet the requirement for a waiver, should they still submit it anyway?
Yes, it's a requirement to submit it before we offer a scholarship. So it is a requirement. They have to go ahead and submit it.
Thank you. Somebody asked if there's a recording for this webinar, and there will be. It will take us a few days to edit it and get it live for you, but it will be posted to the same webpage where you registered. This and all the parent and family webinars will live on that page. You can also register for our upcoming webinars as well. So yes, there will be a recording. Let's see. I think we've gone through a lot of questions, and I feel like we've touched on quite a bit. I guess I will give it a few minutes to see if anybody else. Oh, here we go. We got one that asked about the time to turn around the waiver decision. So if they submit it and they're really great and they do it right on June 15th, how long approximately is the turnaround time?
So we usually try to tell students to give us at least 5 days because we want to make sure we're fully verifying your insurance. It meets the needs. So you will receive a notification within 5 days. We say 5 days because say you submit it on a Thursday or Friday. We want to just make sure that we have enough team to go through it and review it and make sure it meets our university's plan. So
Right.
give it that 5 days and you should hear from us, if not sooner.
Excellent. And the health fee that we talked about before, is that required even if a student is going to take their own health insurance?
Yes, that fee is required regardless of health insurance. That is a mandatory fee for all actively enrolled students.
Okay, and for back to the waiver question, when folks are applying for that waiver, is the insurance card the proof of that insurance, or is there another document that you need?
So when they submit the waiver, they actually upload a copy of their insurance card in the waiver portal, and that is sufficient information enough for us to review it. If we do require further details, we will let you know what we're missing or if something's needed. It happens sometimes mom and dad is submitting the waiver and they accidentally upload a family photo instead of a picture of their insurance card. It does happen. So we might reach out to you and be like, hey, beautiful family, but we do need to see a copy of that insurance card. So we'll just let you know what we're missing.
Great, thank you. And we got a few of these questions in the registration, but I saw one that just came in about athletes, student athletes. Is it recommended for student athletes to take both the Brown plan and whatever other plan? Is there any specific recommendation? And if so, if you have the thinking behind that recommendation?
So typically what we do in these situations is just have them make sure the parent calls their primary insurance and verifies that it covers athletic injuries. You just want to make sure that if the student has coverage for that when they're coming on campus, especially if they're participating in the sport. Some plans do have restrictions on that. So you just want to make sure that it covers them for heart and circulatory and then also athletic injuries.
Great, thank you. You guys are great. I feel like we're on Jeopardy or something. You're getting
I just want
right
to
on the money.
I'm waiting for the buzzer.
I know. Okay, back to you, Christy. the health insurance fee. Can you talk again about what that covers? It covers a wide range of services. Parents are
Just to be clear, we're talking about the health fee, not the health insurance.
sorry, not the insurance
Yes,
fee, health
the health
fee.
fee.
Yes.
Yes. So the health fee covers, so all the departments that I talked about. So for health wise, we're open 7 days a week during the academic year, which I think is important to discuss. And we're open till 7 p.m. Monday through Thursday. And students call and make appointments for a variety of things to be seen for. And all of these visits are covered under the health fee. So students can come in from anywhere from sore throats to injuries to, routine care. They can come in for vaccines. They could come in every day to see one of our providers, and there's no charge for that. It's all covered under the health fee. When your insurance comes into play, say that you came in and you were seen by one of our providers. And typically on most days, we have about 9 providers on per day. And those are a mix of physicians, nurse practitioners, and physician assistants. They came in for a sore throat, diagnosed with strep throat, sent down to the ground level to pick up their prescription. When you present at the pharmacy to pick up that prescription, it's going to get billed to your insurance. So that insurance, on file will be whatever insurance you have on file, whether you waived or you have the student health insurance, and then you're going to pay your copay. It's no different than showing up to a CVS or a Walgreens. You're going to pay whatever copay it is to pick up your prescription, and then you'll be on your way. And then for counseling, it's visits to see a therapist. If you're seeing a therapist, you need to see a psychiatrist. We also have psychiatrists on staff. We have the 24/7 rescue ambulance. So if your child is in their dorm room, they're too ill to walk over to us to go to the hospital, EMS comes out. They are a licensed EMS in the state of Rhode Island. They'll come out, they'll get your student, they'll bring them to a local emergency room. They'll consult with one of our providers here. So if your child goes in the rescue through Brown, there's no charge to you or to your insurance or anything. It's all part of that health fee. We also have our Be Well Health Promotion, who does events all around campus to promote health and well-being. Those are all covered under the health fee. And on our website that I know that Mikkel shared earlier, there is even a list longer than this of everything that's covered under that fee.
Yeah, it's a wide range. So really the health fee is more of the general concerns, that sort of value added health and wellness aspect that the students are going to experience on campus. And then the insurance part is the more specific, individualized care.
Yeah, it's your medications, picking up your prescriptions. If you were wanted to see one of our providers here, the lab in our building is a lifespan laboratory. You go down to the laboratory, their lifespan laboratory is going to bill, your insurance for those lab tests. But the actual visits with the provider, whether what you saw far, there is no copay, there is no charge to your insurance for any office visit.
Right. And somebody's asking if most of the appointments through the Brown Insurance are on campus.
For to see somebody like a specialist, or
I'm wondering is it in person? Is it telehealth? Is it,
at Health and Wellness?
Yeah.
The majority now are all in person. I mean, there are rare circumstances where a provider may do a check-in with a student via Zoom telehealth. But, we do have restrictions that through federal regulations, we can only do telehealth within our state lines. So we have to make sure that if a student's on campus, we can do that. But I would say almost 95 to 98% of our visits are all in person.
And I think it's helpful to note for our families here that the Health and Wellness Center is brand new. It's state of the art. All the services are, for the most part, under one roof. The emergency, the pharmacy, the clinical, mental health. Am I correct, Christy?
You're absolutely correct. We have our own radiology. So we do x-rays here as well. We have a pharmacy and we have a laboratory all within the same building. So we try to see ourselves like I said, as holistically as possible with our counseling, with our health, to take care of the student with everything we can do within our four walls.
Great. Question about how the pharmacy prices compare to a CVS or Walgreens?
As far as what's billed to the insurance, or because it's going to depend on what your insurance copay is, and what is covered. Ashley, I'm not sure if you'd like to.
So are they talking about if they're filling a prescription with the school's insurance, or like at the wellness center?
Well, so they go on to ask, could a student choose to use CVS and Walgreens instead of Brown Pharmacy? So I don't know, say they don't want to walk over to the Brown Pharmacy and CVS is closer on Thayer
Understood.
Street, can they go there?
Understood. So the CVS on Thayer Street actually doesn't have a pharmacy.
Oh, correct.
Yeah,
Know that.
so we are definitely the most convenient pharmacy for the students. There are some, for those of you who do know the East Side, there is a CVS in Wayland Square. But it's not a close walk. It's a little bit of a distance. Our pharmacy does carry a small amount of over-the-counters too. I say small, shouldn't really say small. They have quite a few over-the-counter medications that students may need, whether it's Tylenol, Motrin, cough medicine. They can come right in and pick that up as well. And anytime we are open, the pharmacy is open. So like I said, during the academic year, they're here 7 days a week.
And so if somebody doesn't take the Brown Health Insurance Plan, they can still use that pharmacy, correct?
Absolutely. And the pharmacy will just bill your insurance, just as you picked up your medicine at CVS, you're going to be charged the same copay at the pharmacy here.
Great. Another financial aid question, the health fee that we've been talking about, Grace, when a student got their package from Brown, is that fee included in that that information that they would have received, or is it something that they need to add into their calculations?
No, it is not. It's not included in the budget or the cost of attendance. So the financial aid package is only the based on the cost of attendance, which is tuition, room, board, and the mandatory fees. Health insurance is not part of it. So yes, that would be something additional, an additional cost. But like I said, if they don't have the insurance comparable to what is offered, that's offered through United Health that we offer here, we do have scholarship for that, but that's completely separate. Correct. It is not included in the financial aid package, in the budget, or the cost of attendance.
Okay, thank you.
So Grace, what about the health fee, not the health insurance fee? Is that considered a mandatory
Yes.
fee?
That's a mandatory fee. So all of the fees you're charged for, they're all mandatory fees. That's included in the cost of attendance. And yes.
Okay, so the health fee is
$1,000
included, but the health
fee?
insurance fee is not.
Correct.
Okay.
So the 545 semester, that includes all the things Christy has been talking about. That is included in yes, that is, but the 4,000 for the health insurance is not.
Got it. Okay.
Yes.
All right. So I'm sure there's a lot of parents of new students at home making those calculations. So that's really helpful. This is from, I'm assuming this is somebody in Canada who's asking if US pharmacies can accept prescriptions written by Canadian doctors.
They cannot. Prescriptions cannot cross over.
And is that just Canada or is that worldwide?
That's worldwide.
Okay, so it has to be prescribed by a US doctor to be filled within the United States.
And that's an easy way to do that. If it's a medication, what we do recommend is have the student come in with either something written from their doctor, their prescription bottle, and make an appointment to see one of our providers, and we can get that rewritten for them to be able to fill here.
Okay. This is another good one. I guess, Ashley, if parents are sitting down and making that decision, is there a process or a strategy that you recommend to comparing side by side if they already have insurance that would cover their student and they're looking at the Brown plan? What's the best way of going about that comparison?
Yeah, so typically you want to look at how much you're paying for the student themselves compared to what the Brown University plan is. And then a big one is looking what your out-of-pocket maximum is what your deductible is for the student. And then if there's a lot of things that the student currently is using, say they're going to see a therapist a couple times a week, if they're going to physical therapy, just what that cost apples to apples would be if they're still continuing seeing that treatment throughout the year as well too.
Great, thank you. As we have about 5 minutes left, and so I think I want to wrap up by going around Christy, Grace, and Ashley, the best way to get in touch with the office you represent, and just any really like key takeaways that parents and families should bring with them after this webinar. Christy, I'll start with you.
Thank you. Absolutely. So the best way to ask any student insurance related questions would be to email studenthealthinsuranceplan@brown.edu. There is multiple people monitoring that box, so it's the best way to get a response. And I think the last piece that I just want to bring up, and I really appreciate your time today, is for any parents on here who are new, please know your students are going to be in great hands with us, and always reach out to us if anything you need. And when it comes to your tuition bill and when things start being charged, please know that whether you're going to waive or you're going to enroll, every student, that fee is going to be charged to your bursar account. That $46.36 is going to be on your account, and it will be removed after your waiver is approved, and it takes 3 to 5 days. Sometimes people assume the charge doesn't go on until after they choose to enroll, but because we want to make sure that every student does have adequate health insurance, every student is charged for it and will be enrolled if you do not take action and do the waiver process. So again, I really enjoyed spending time with you today, and please reach out if there's anything you need.
Thank you so much, Christy. Grace, same question for you.
Yeah, sure. I would suggest you look at our information in the financial aid package. If you do have a financial aid, our contact information is on there. It is financial_aid@brown.edu. Our phone number is also there. And also same as Christy, we're here to help. If you have any questions, we work closely together. If you ask us something that we may need to refer to health services, we'll go ahead and do that. And vice versa. If you have financial aid questions that you sent to Christy accidentally, she will definitely send that over to myself.
Great, thank you, Grace. And finally, Ashley.
Yeah, so I am happy to be here on this meeting. I think we got a lot from this. I hope you guys did too as well. We're here to help you. So if you got any questions in regards to the waiver portal once it's open, or submitting enrollments, happy to help. Just shoot us an email or give us a call. Our team is here. We have a whole team of everybody that's trained on Brown's account. So anybody that picks up that phone will be able to assist you.
Great, thank you. And I'll let everybody know that if you have questions about where to send your question to, you can send it to me at family@brown.edu. That's the Department of Parent and Family Engagement. And whether it's about insurance or something else, we will get you where you need to go.